Hello, good day. I'm Dr. Bashir Waziri. I'm going to demonstrate how we can use virtual reality to explore human anatomy and physiology. As you can see, this is a virtual lab looking very beautiful, and we have bed, the exit door here. So if I want to explore any part of the body, I will just click on my tool panel and then select the parts I want to explore. As you can see, I'm seeing a beautiful skeleton in front of me, and I can study this skeleton in this virtual lab. I can study any bone by clicking on it, and then I can remove it from the body if I like, and study it using my information panel. So let me use this. You can see written humerus left. Then I can study it by clicking on info panel. It will appear. So you can read the information about the humerus from this information panel. Then I can take it back to where it is. And then I can remove the info panel. I can take the skull. Let me enlarge it so that we can see it clearly. Now, this is the skull, and I can unfold it into different bone components. You can see appearing very beautiful, and I can take any bone I like and read about it by clicking the info panel. As you can see, I'm now taking the frontal bone. If I take this, it is showing parietal bone right, and the information appears on the info panel. So this virtual lab is very important and very useful in learning. Students can explore any parts of the body they want to. Maybe after attending the theoretical class, they can then enter the virtual lab and then study it, and they will be able to retain the information because they are the ones doing it by themselves practically. So I can fold it back and then take it back to where it is. Now let me take another organ. As you know, the heart is located in the chest inside the pericardium. So you can see I'm removing the pericardium, the parietal layer of serous pericardium, the visceral layer, and then the epicardial adipose tissue, and this is the heart. I can draw it closer to me, though it is appearing small, so I can enlarge it so that we can see it clearly. Beautiful. So this is the heart. You can see the information panel. The human heart is a muscular blah blah up to the end. We are just demonstrating how the lab is working. So I can study different parts of the heart. I can rotate it. You can see this is part of the right ventricle. If I rotate it like that, this is some part of the left ventricle, and you can see this is the arc of aorta. Yes. So I can unfold the heart so that I can study different component of the heart. Yeah, you can see it. This is part of the right ventricle anterior wall, as I have said. Now, if I look inside the right ventricle, we can see the interior of the right ventricle clearly. You can see the tricuspid valve, where this deoxygenated blood from the right atrium enters the right ventricle. We can also see those white fibers, the chordae tendineae attaching the cusp of the tricuspid valve to the ventricular wall. If I remove this component, which is posterolateral wall of left ventricle, I can view inside the left ventricle. The mitral valve is there, where oxygenated blood from the left atrium enters the left ventricle. So this is just in a nutshell how this virtual lab can be used to study different components of the body. Now, another feature it has, I can remove all these components of the body, and then I can be an ant by clicking on ant mode, so that I can enter the organ, whether it is the heart or the stomach or whatever, to study it clearly. So let me remove the skeleton. As I said, I can be an ant. The heart will appear very large in front of me. I want to enter the interior of the heart and study it clearly. I'm moving inside the heart. You can see now I'm in the right ventricle. In front of me clearly is the tricuspid valve. I can even see the interior of the right atrium from the right ventricle. So you can see the tricuspid valve with the leaflets. That's why it is called tricuspid, because it has three cusps. And you can see the chordae tendineae attach the cusp of the valve to the ventricular wall. The image is very beautiful. So we can go into the right atrium. Right atrium, yes. This is the right atrium. Here I'm looking at the opening of the inferior vena cava, where deoxygenated blood enters the right atrium. And you can see above me is the opening of superior vena cava, where also blood returning from the head, neck, and upper limbs enters the right atrium. So let's go outside. Then we are going to the left ventricle. This is the interior of the left ventricle. We can see the mitral valve, where oxygenated blood from the left atrium enters the left ventricle. And here I'm looking at the aortic valve, where the oxygenated blood from the left ventricle enters the aorta and then the systems of the body. You can see it also beautiful. Okay, let me look at some. Okay, this is also in the virtual lab. You can see it's representing the skin layers. You can see the dermis, the epidermis. This is the dermis. You can see the hair follicle clearly. I can even remove it and study. And if I click on the info panel, I will be able to read about the hair follicle, and I can remove the epidermis. Yes, and then if I look at the info panel, you can see information about the epidermis. And these are the layers of the skin. Here, if I remove, you can see blood vessels beneath the dermis and glands. So this is just to show you how virtual reality is very useful in learning and teaching purposes, because all this what I'm doing, I can record it. I can record my lecture demonstration using virtual reality, so that I can just project it to my students, and then I can also project the live demonstration to them. So also students can enter the virtual lab and study whatever they like. So virtual reality is not only used for games, it's very useful in learning and teaching, especially in anatomy and physiology. Thank you. This is another picture of the lab. You can see I'm seeing some movement of the head, and by looking at it, I can be able to explore which muscles are responsible for this movement. So you can see this is sternocleidomastoid of the left side, and this is sternocleidomastoid right side. So this is a blood vessel in front of me. I can enter the blood vessel and see different type of cells inside. You can see it is appearing big. So let me enter inside. Yes, so I'm now within the blood vessel. You can see different type of cells. I can see red blood cells. I can see platelets. I can see lymphocytes. So this is just to show you different cells that are within the blood, and any cell you pick, it will show you the name. As you can see, I'm clicking on erythrocyte. These are neutrophils. These are thrombocytes, the platelets. So as I said, virtual reality is very important, and these are some of the technological innovations that can be used to facilitate teaching and learning, because the student and teachers will be exploring the body components by themselves practically. So this will help in demonstration and facilitate learning and teaching procedures or purposes. Thank you.